Purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice or medical suggestions. Please see your local board and state-certified health professional. The views of this podcast represent those of my guests and I.
Good evening, ladies and gentlemen. Welcome to the Pharmacokinetics Arena for tonight's thrilling basketball matchup between Team Absorption and Team Excretion. We're about to witness a high-stakes game that mirrors the journey of a drug through the human body, from the moment it enters to the moment it exits. Tonight's game will showcase the vital processes of absorption, distribution, metabolism, and excretion, the stars of pharmacokinetics. Ladies and gentlemen, please rise and remove your hats as we honor the science that fuels our understanding with the anthem of pharmacology. Play or sing National Anthem. And now, ladies and gentlemen, the introduction of tonight's starting lineups. First for the visitors, Team Absorption.
Starting at small forward, standing tall at permeability, a key player from gastrointestinal tract number 1, passive diffusion. Explanation. I'm the smooth operator on the court, effortlessly moving the ball or drug molecules from an area of high concentration to low concentration, just like I move drugs across cell membranes without requiring any energy.
Starting at shooting guard, a dynamic carrier protein from intestinal lumen. Number 2, active transport. Explanation. I'm the team's powerhouse, requiring energy to move drugs against the concentration gradient, ensuring even the most challenging drugs make it through the defense and into systemic circulation.
Starting at point guard, a selective stopper from cell membrane. Number 3, efflux transporters. Explanation. We are the defensive specialists, often pushing drugs back out of cells, preventing overaccumulation and regulating absorption.
Starting at power forward, with the ability to increase bioavailability. From pharmaceutical formulations. Number 4, first pass metabolism. Explanation. I'm the barrier breaker, representing the initial passage of a drug through the liver, where it is metabolized before reaching systemic circulation. The result? Reduced bioavailability, but a crucial part of the team's strategy.
And at center, a towering presence in drug solubility. From lipophilic region, number 5, lipid-soluble drugs. Explanation. We are crucial players, seamlessly moving through cell membranes, increasing the absorption rate, and ensuring that drugs reach their targets effectively.
Assistant coaches for Team Absorption are gastric pH, food intake, and drug formulation. The head coach is bioavailability. And now, let's meet the starting lineup for the home team. Team Excretion, starting at small forward, the precise filter from glomerulus number 1, glomerular filtration. Explanation. Glomerular filtration is the cornerstone of renal excretion, responsible for filtering drugs from the blood into the urine, setting the stage for the elimination process. Starting at shooting guard, a smooth mover through the nephron tubules. Number 2, tubular reabsorption. Explanation. Tubular reabsorption steps in to reclaim water and valuable solutes, sometimes pulling back drugs from the urine into the bloodstream, akin to a quick pass back into play. Starting at point guard, the secreting sensation from renal tubules. Number 3, tubular secretion. Explanation. Tubular secretion is the agile player that ensures unwanted drugs are actively secreted into the urine, clearing the system like a fast break towards the basket. Starting at power forward, the big presence in bile production. From liver. Number 4, biliary excretion. Explanation. Biliary excretion handles the tough tasks, moving drugs into the bile for excretion via the feces, much like a powerful forward pushing through to score. And at center, the ultimate closer total clearance from kidneys and liver. Number 5, drug clearance. Explanation. Drug clearance is the MVP, representing the overall efficiency with which the body eliminates a drug, determining how long it stays in the system, and thus its overall impact. Assistant coaches for Team Excretion are urine pH, liver enzymes, and plasma protein binding. The head coach is renal function. Your officials for tonight's game are Pharmacokinetics, PK, absorption, distribution, metabolism, and excretion. The 4 referees who ensure that every play is understood, every move is monitored, and the journey of every drug through the body is thoroughly mapped out. Tonight's matchup is a metaphorical journey through the human body, where every player represents a vital process in pharmacokinetics. By understanding how these teams work together or against each other, we gain a clearer picture of how drugs move through the body, how they reach their targets, and ultimately, how they are cleared from the system. Let the game begin. This creative narrative incorporates the concept of a basketball game, with each position representing a critical component of pharmacokinetics, allowing for an engaging and educational exploration of these important processes. Welcome, everyone, to the most anticipated match in the world of pharmacology, the Biopharmaceutics Derby. Today's game is not just any ordinary soccer match. It's a battle where the drug's journey through the human body, from administration to action, is reimagined as a strategic and thrilling soccer game. On one side, we have Team Pharmacokinetics, known for their methodical control of the ball as they navigate through the body's complex systems. On the other, we have Team Pharmacodynamics, experts in creating game-winning goals by interacting with the body's receptors. Let's dive into this action-packed narrative where each play represents a key concept in biopharmaceutics. And we're off! Team PK takes control of the ball, representing the drug molecule's journey through the human body. They begin with a critical phase, absorption, where the drug makes its first move past the body's defenses and enters the systemic circulation. Absorption is a crucial first step. The players must get past the defense, ensuring that the drug enters the bloodstream. This phase is akin to the initial dribble. Will the drug be absorbed effectively, or will it be broken down by enzymes in acidic environments? Here we see the drug use passive diffusion, a smooth, energy-free dribble gliding past the defenders, thanks to its lipid solubility. For more challenging terrains, active transport is employed, using carrier proteins to cross the cell membrane, much like a player using fancy footwork to bypass an opponent. However, the presence of efflux transporters, like P-glycoprotein, can push the ball back out, preventing successful absorption. With the drug now in the bloodstream, Team PK's strategy shifts to distribution. Here, the ball must be passed to various tissues, just as a team spreads the ball across the field to find the best path to the goal. But not all passes are straightforward. The drug may bind to plasma proteins, like albumin, temporarily taking it out of play, much like a player holding onto the ball but not advancing it. Only the unbound drug can move towards the target tissues, representing the active player making crucial passes. The volume of distribution is like the field size. A larger volume of distribution indicates that the drug has spread widely into tissues, much like a long pass reaching deep into the opponent's territory. Now, Team PK advances into the attacking third with metabolism, where the liver plays the home advantage, breaking down the drug to either activate it or prepare it for elimination. The Phase 1 enzymes, particularly cytochrome P450, take the ball and dribble through the defense, oxidizing, reducing, or hydrolyzing it to make it more reactive, much like setting up a shot. In the final approach, Phase 2 metabolism adds larger molecules like glucuronic acid, making the drug more water-soluble and ready for elimination. It's the equivalent of a perfect setup for a strike at goal. As the attack concludes, it's time for Team PK to switch to defense, excretion, where the drug is cleared from the body, much like a defensive line, ensuring that the ball is cleared from the danger zone. The kidneys, acting as goalkeepers, filter out the drug from the bloodstream into the urine. Some drugs are reabsorbed in the renal tubules, a bit like a defender passing the ball back into play instead of clearing it out. Alternatively, the liver might kick the drug into the bile for excretion through feces, a more long-range clearance strategy. And that brings us to the end of the first half. Team PK has skillfully maneuvered through absorption, distribution, metabolism, and excretion. Now let's see how Team PD will counter in the second half. The second half begins, and Team PD takes control. Their play is all about how the drug affects the body. Will it be a subtle nudge or a game-winning goal? Let's see how they manage receptor interactions, dose-response relationships, and therapeutic outcomes. The drug now binds to its receptor, initiating a series of effects, like a striker receiving a pass and setting up a goal. Agonists, like star players, activate the receptor and produce a full response, pushing the game forward. Antagonists, however, are like a well-placed defender, blocking the receptor and preventing any action, effectively neutralizing the play. Partial agonists score a weaker goal, as they only partially activate the receptor, while inverse agonists push the response in the opposite direction, akin to scoring an own goal. Team PD now demonstrates their strategy with dose-response curves, much like adjusting their formation based on the opponent's play. Potency is about the concentration of the drug required to produce a specific effect, like the minimal effort needed for a precise pass. Efficacy, on the other hand, represents the maximum effect a drug can produce, much like scoring a goal regardless of how many attempts it took. The therapeutic window is the safe zone on the field, where the drug is effective but not toxic. Stepping outside this zone risks underdosing or causing harm, like playing too close to the sidelines. As we move into the final third, Team PD aims to maximize therapeutic effects while minimizing side effects. A delicate balance much like attacking without leaving the defense exposed. This is the goal, the desired outcome of the drug's action, akin to putting the ball in the back of the net. But beware, adverse effects are like the opposition's counterattack. Too much drug or interactions with other medications can lead to toxicity, like an own goal that could cost the match. In the final moments, Team PD focuses on long-term strategy, managing tolerance, dependence, and drug interactions to ensure continued success. Over time, the body might become tolerant, requiring higher doses to achieve the same effect, like a team needing to up their game as the opponents adapt. Dependence is when the body relies on the drug to function, much like a team depending on a star player for every match. Lastly, drug interactions are like complex team strategies. Some combinations lead to synergy, while others result in antagonism. Full-time analysis, the harmonious victory, and that's the final whistle. Today's match has been a comprehensive display of biopharmaceutics in action, where Team PK and Team PD have demonstrated the intricate balance required for a drug to be both effective and safe. This derby highlights the importance of understanding both the journey of a drug through the body and the complex interactions that determine its ultimate impact. In the end, the real victory in biopharmaceutics is the harmony between pharmacokinetics and pharmacodynamics, when a drug is properly absorbed, distributed, metabolized, and excreted, while effectively binding to its target and producing the desired therapeutic effects with minimal side effects. This ensures that the patient or the team wins every time. Pharmacokinetics, often abbreviated as ADME, stands for absorption, distribution, metabolism, and excretion. Absorption is the process by which a drug enters the bloodstream from its site of administration. Distribution involves the dispersion or dissemination of substances throughout the fluids and tissues of the body. Metabolism refers to the chemical alteration of a drug by the body, primarily in the liver, to make it more water-soluble for excretion. Excretion is the removal of the substances from the body, primarily through the kidneys via urine or through the liver via bile. Now let's dive into some absorption concepts.
Passive diffusion is the movement of drugs from an area of higher concentration to an area of lower concentration across a biological membrane without energy input.
Active transport is the movement of drugs against a concentration gradient, requiring energy, usually in the form of ATP.
Efflux transporters, such as P-glycoprotein, are proteins that pump drugs out of cells, often reducing drug absorption and distribution.
Bioavailability is the proportion of a drug that enters the systemic circulation when introduced into the body and is able to have an active effect. Moving on to distribution concepts. Volume of distribution, VD, is a theoretical volume that relates the amount of drug in the body to the concentration of the drug in the blood or plasma. Plasma protein binding is the degree to which drugs attach to proteins within the blood, affecting the drug's distribution and activity. The blood-brain barrier is a selective barrier that prevents certain substances from entering the brain, impacting drug distribution to the central nervous system. Tissue penetration refers to the extent to which a drug moves from the bloodstream into the tissues of the body. Next, we have metabolism concepts. Phase 1 reactions, including oxidation, reduction, and hydrolysis, are chemical reactions that modify the drug's structure, often introducing a functional group, making it more polar. Phase 2. Reactions, or conjugation, involve the attachment of an endogenous substance to the drug, making it more water-soluble and ready for excretion. Enzyme induction and inhibition are processes by which certain drugs increase, induction, or decrease, inhibition, the activity of metabolic enzymes, affecting the metabolism of other drugs.
The first pass effect is the initial metabolism of a drug that occurs in the liver before it reaches the systemic circulation, reducing the amount of active drug available.
Lastly, let's look at excretion concepts. Renal excretion is the process by which drugs and their metabolites are eliminated from the body via the kidneys through urine. Biliary excretion is the elimination of drugs through the bile, which is then excreted in the feces. Clearance is the volume of plasma from which a substance is completely removed per unit time, indicating the efficiency of drug elimination. And finally, some key pharmacodynamics concepts. Receptor binding involves the interaction between a drug and its specific receptor, where agonists activate the receptor to produce a response, and antagonists block the receptor to inhibit a response. The dose-response relationship is the relationship between the dose of a drug and the magnitude of its pharmacological effect. Potency refers to the amount of drug needed to produce a specific effect, while efficacy refers to the maximum effect that a drug can produce regardless of dose. The therapeutic window or index is the range of doses of a drug that elicits a therapeutic response without causing significant adverse effects. The therapeutic index is the ratio between the toxic dose and the therapeutic dose of a drug. Therapeutic effects and adverse effects. Therapeutic effects are the desired beneficial effects of a drug when it is administered at the appropriate dose. Adverse effects, on the other hand, are unintended and often harmful effects that occur with drug use, ranging from mild to severe. Then there's tolerance, a phenomenon where increasing doses of a drug are required to achieve the same therapeutic effect, often due to repeated use. Dependence is a condition in which the body adapts to a drug, requiring it to function normally, leading to withdrawal symptoms if the drug is discontinued. And let's not forget drug interactions, which can be either synergy or antagonism. Synergy occurs when the combined effect of two drugs is greater than the sum of their individual effects, while antagonism occurs when one drug reduces the effect of another. General biopharmaceutics concepts. Bioavailability is the fraction of an administered dose of unchanged drug that reaches the systemic circulation. The clinical relevance of a drug's pharmacokinetic and pharmacodynamic properties is crucial in predicting its therapeutic efficacy and safety in patients. Drug interactions are the effects that occur when the action of one drug is altered by another drug, food, or substance, which can enhance or diminish the drug's effects. Lastly, formulation impact refers to the influence of the drug's form, such as a tablet, capsule, or injection, and its excipients or inactive ingredients on its
Purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice or medical suggestions. Please see your local board and state-certified health professional. The views of this podcast represent those of my guests and I.